Remember, our innate intelligence flows with our nervous system for everything, but there is the innate intelligence at the cell level. And this technology, and shockwave specifically, there's different forms of it. This is a sound wave, travels into the cell, and basically allows innate intelligence to release, to focus the body right at that cellular level to become whatever it needs to.
Welcome to Ending Chronic Disease, where we challenge everything you thought you knew about health. Join international best-selling author and wellness pioneer, Dr. Fabrizio Mancini, as he reveals how to transform your body, your mind, and your life starting today.
Hi, everyone. This is Dr. Fab Mancini, and I'm super excited that you're with me. Primarily, as you know, my goal is to bring you insightful information that would allow you to make better choices, that would allow you to live a healthier lifestyle, that would allow you to reach your life potential, in my opinion, where many times our health is our biggest deterrent for doing that. And today I have one of my favorite people in the world, and Dr. Curtis Martin from Canada, even though he's in California with many of his clinics. Curtis, it's so great to see you again. Thanks so much for making time from such a busy schedule.
Yeah. Thanks, Dr. Fab. It's my pleasure to share with you today and share with our audience. This is going to be hopefully a really exciting and transformational experience for everyone listening, and really get some good information today.
Well, I know that, first of all, you've had a tremendous success being a doctor of chiropractic. You've always been ahead of the times because you were one of the first pioneers in regenerative medicine. You were one of the first pioneers in shockwave therapy.
Yes.
And now, of course, hydrowave, which is revolutionizing healthcare. Tell me a little bit about where did this passion come from for you to want to even become a doctor of chiropractic? What was your initial thought that you wanted to participate in this type of healthcare profession?
Well, for all of you listening, I think all of us have got called to be a doctor for different reasons. I remember my calling to become a chiropractor is because chiropractic saved my dad from back surgery. So it was always inspiring me as a child to watch my dad's life change because he had chiropractic. And then how I got into regenerative medicine was a bad injury that I received in 2016 that took my health down, and I've been serving our community for 20 years before that point, just with chiropractic, subluxation-based and wellness model. And looking at that, I looked at it just helped so many people with the power of our hand. And then facing this injury that I received, I was going to get surgery in my back. So the orthopedic surgeons, unfortunately, wanted to do a double laminectomy, and then they wanted to cage L4, L5, and S1. And I thought about it a lot, and I thought, it can't be. It just can't be. I've seen so many miracles in chiropractic. I was like, you know what? There's got to be a solution. So ultimately, it went through a lot of injuries, from physical to mental, social, spiritual. I lost kind of everything. Everything went down. And how I fought my way back was spiritual. And I prayed for the answer, and it led me into stem cell research that ultimately, I stand in front of you right now being pain-free. So thankful, so grateful. And regenerative technologies with stem cells and stem cell therapy is what brought me back. And once I got my own health back, then I was called upon to be of exponential service to really help doctors to go, what about those patients like me that are at home facing surgery? And that's where I found Shockwave about 5 years ago. And it took off only because my heart was touched. And we know that you can't hold down passion. And that was my passion, is to bring Shockwave as one of the modalities with other ones to really help people get well. And that's really why I was inspired to do so.
Well, let's talk a little bit about that, because in this healthcare space, you were introduced to Shockwave about 5 years ago, which is kind of like the time that I think it really started taking off. But there may be some of my students or some of the doctors and some of the people that are listening right now, and they hear about Shockwave, but they don't really understand. I mean, you have trained, hundreds of doctors on this technology. You have created some of the best protocols in the healthcare industry and how to properly use it. Tell me a little bit about, in layman's terms, so what was it about Shockwave? What is the Shockwave technology, in your opinion, that is bringing to the healthcare system that really helped you not only advance or facilitate the healing, but more importantly, it's helping so many people out there that are really having a lot of difficulty with pain and inflammation?
Yeah, and that's the first level, is pain and inflammation. And for the people that don't know too much about Shockwave right now, the most easiest way I can let you understand is it basically goes to wherever the damage of the body that's been diagnosed and treats it at a cellular level. Remember, our innate intelligence flows with our nervous system for everything, but there is the innate intelligence at the cell level. And this technology, and Shockwave specifically, there's different forms of it. This is a sound wave, travels into the cell, and basically allows innate intelligence to release, to focus the body right at that cellular level to become whatever it needs to. So when you stimulate those cells, it'll transform that body to whatever the injury is through the innate intelligence to go, I need more bone, more muscle, more tendon, more ligament, more nerve sheath, more vessel. Whatever seems to be the problem there that needs some special attention, this cell signals that body at that level to go to work. And that's why it's so special, because it works on all musculoskeletal problems. As long as you're able to diagnose where the tissue is wrong and set that with special systems and techniques, you will get miracles. You will give so much hope to your patients, because they will see very quickly the power that made the body can heal the body with these advanced technologies. It's absolutely transformational. It's miracles that happen every single day in my practice because we have this technology. It's absolutely fantastic.
Well, I've been receiving Shockwave treatments over the years when it first came into the scene, because I love to experience everything out there that is helping people get well. Anything that facilitates the self-healing of the body, I'm always going to be supporting. That's one of the reasons I wanted to be a doctor of chiropractic, because to this day, I still have not found anything that can facilitate healing more than your ongoing chiropractic adjustments. And for me, that's once or twice a week for the last 38 years. I don't miss it. I do not miss it. That is the one thing. It doesn't matter where I am in the world, I will find a chiropractor to adjust me. But let's talk a little bit about the evolution of Shockwave, because even though you've been in that space for the last 4 or 5 years, and you have trained people, you really got into the science behind it. You're one of the best trainers that I've ever seen. You're so good at educating us, the doctors, that we weren't taught this in school, right? I mean, I was president of Parker University. We didn't have Shockwave in our training. But then all of a sudden, we evolved into Hydrowave. So help me understand the basic difference between going from Shockwave technology to Hydrowave technology. What is the main difference? And why do you feel that Hydrowave now is taking it to a whole new level as far as facilitating that healing in the patient?
Yeah, and that's a great question, Dr. Fab, because it is, when you look at Shockwave, is very much, there's different categories. And so there's 5 different categories, really. There's the electrical, then it comes to, they call that the piezoelectric. Then you go into the next level of things, which is more of the electromagnetic. Then you keep going up the echelon of radio waves. Then you get to electrical hydraulic. And then the final one is magnetohydraulic. And all of them are different. And really what it comes down to, they're all different prices, but they're all different tools. And the most versatile tool, being a chiropractor, that I've been able to find has been the magnetohydraulic. And Hydrowave specifically, I had such a hard time to treat with different protocols I developed to reach some of the tissues in the hip, in the knee, in the lower back discs. And you have to be so careful about whether you're really categorized. I think a lot of Shockwave doctors, they all say, I'm the best. But really, if they could have a better conversation in terms that would understand, like, there's 5 different categories, 5 different prices, but also there's different techniques you use. So if someone has pain inflammation, that's a different technique. If you have regeneration, that's a different technique. What about breaking down tissues like a calcium ball or maybe a calcified tendinosynovitis or maybe a myofascial trigger point? You have to have more of a catabolic technique. So I've been able to really base things on our clinicals, which is diagnosing and then using the machine to confirm the diagnosis and then getting the right category of what we're trying to achieve as doctors. And I think if we all would have a better conversation, that's why a big key for me is educating with our systems, not only the doctor to patient, but also the entire team to represent a good culture, that you really will stand apart from any other office in the community because you're able to communicate what it does, how it does it, what's your outcome, what's your prognosis, in a nice ABCD format that you can actually teach your Shockwave in certain states, your technician, on how to represent, how to do this therapy to get great results and represent your clinic the way that your reputation should be in your clinic and your opportunity.
Well, let's put it into real discussion. You have taken care of thousands of patients, from some of the most elite athletes to celebrities to you name it. Tell me maybe a couple of stories of the type of patients that you have felt this Hydrowave technology really was something that you felt like, thank God that I have that available for my patients.
That's a great way to segue in, because that's what ultimately comes down to, right? Patient-centric care. I get so excited, as you can tell. Sometimes I even I have so much to share with you. I trip over my own words because I'm like, I want to share with everybody. They should have this tool in their office every single day. And I have a good friend of mine that's a medical doctor, and we had a long conversation about cellular healing over 10 hours. And he said, I think chiropractic should get your diploma and have a Shockwave as your tool of synergy in your office. But that being said, let me answer your question. I think some of the things that just are transformational when people have been, for me, people that have been injured for years and years and years, which means they've had that chronic back pain never gone away, because chiropractic can align the nervous system, but we can't fix the damage from the subluxation. And this Shockwave turns back the hands of time to really help the regeneration at that damaged subluxation level. I have one person that really stands out, and I could say a lot of people that were destined for surgery didn't need it. But I remember she was a coach, and she looked after women's gymnastics, had many of their gymnasts that went to the Olympics. This was in California, so high-level gymnastics. And she was a gymnast, and through injuries with her feet, being a gymnast, that her big toe didn't move. And so then she started walking to the side like a club foot. And they just said, well, sometimes because of injuries, they couldn't find where the entrapment was. She had chiropractic and physical therapy, nothing worked. The first time I used Shockwave on her big toe, and specifically opened up the nerve supply too with our protocols, I remember her looking down her toe, and she wiggled it for the first time in 10 years. And I remember her looking down, she goes, no, you don't understand. That has never moved in 10 years. And she walked around my clinic full of patients. She walked in every room and goes, oh my gosh, oh my gosh. And she's walking her, she goes, watch, I can walk without a limp. One session, I said, you need more of sessions to become more permanent, but talk about an accelerator for hope. When the physicians told her that would never get better, she had big callus on the side of her foot because she had to walk with a club foot, to going one introduction to this chiropractor that some of her mom that I was looking after, some of the gymnasts, and she was able to walk again properly, like walk again without the limp, toe off the way it was supposed to, and really wiggle. I mean, if she was more a sensitive person, Dr. Fab, I bet she would cry. I bet she would just tears roll down, because unless you've been seriously hurt, you don't understand when you've been given the gift of health again. It's the biggest gift in the world. And to change that instantaneous, I mean, I was just, to be witness of it, I was just in awe. And I was like, and again, these are the little things and big things for them, little things as a doctor we get to witness that inspire us to bring these things into our office, because your patients deserve them.
What are some of the most common type of cases that you have found the Shockwave to really be a very, very good solution for some of the cases that other people may be struggling because either they're going to an allopathic doctor that may not have the kind of understanding towards root cause and biomechanics and nerve function that we do in chiropractic, but also individuals that potentially doctors that were not trained in this technology that don't know where they should apply it or they could apply it.
Yeah. Great question. I mean, there's some several diagnoses come to mind, but the three most common body parts that I see that are will change your patients' lives is osteoarthritis in the knee, and that this is Hydrowave can treat that all the way through the compartment and actually start the regeneration and cell signaling in the body from the deepest part of that joint. And of course, all of us that are listening that have been in practice a long time, whenever you have one joint that's affected, a knee, it always affects above and below. And specifically, Hydrowave can get in on that hip, that horseshoe on the knee, and treat those hips. And for people that are struggling with a hip problem, a knee problem, a lower back disc, this is the tool for you. And of course, if they have a shoulder that's a torn labrums, that's where I've seen them go through all that musculature, all that deltoid, to actually treat the joint and restore that. Those are four that are just, I would say, the top ones I see, and people have such a hard time finding a solution for without Shockwave.
Yeah, and it's interesting because the first time I remember that you took care of me, we were both working at an event, and I'll be very honest with you. Here's some of the things that I was very surprised. Number one, I was surprised about your protocols, because you have a very unique way of applying the technology to your patients. Number two, I was surprised of how quiet the technology was in comparison to other Shockwaves that I've had that were a lot noisier. And number three, I was very surprised of how quickly the treatment was and how good I felt immediately. I mean, you saw that within less than 5 minutes, I felt almost 90% relief. And I couldn't believe it. I was like, what did you just do to me? Because I have experienced Shockwave, but I had not experienced Hydrowave, but I definitely had never experienced your protocols, which tend to be, what is it that your focus is when you're using Hydrowave? What is it that you're trying to accomplish as the doctor when you have a patient in front of you and you have this technology and all of your experience and all of the years trying different things, try to improve the outcome of that patient?
Yeah, and I think it goes back to really our roots as a chiropractor, and our roots was always detect subluxation and remove it as quickly as possible. And as you and I had found, the more efficient that you can become on detecting and correcting subluxation. And the things with Shockwave are no different. We're removing interference, and that's really what it comes down to. And removing interference for a lot of people that are suffering, it's not a big area, it's very small. And so I base my technique is really based on that premise of removing the interference to allow the body heal, and then using systems of the body. That's where really I think where our protocols stand out is using the global systems of our body. And let me just touch on some of those systems, just so people are like, well, what are these systems? Are they a miracle? And you'll know some of them because you're a chiropractor. But our technique is really based on delivery of cell signaling and energizing those cells that need healing. Number two, how do you accomplish bringing more blood flow to that area? How about the central nervous system? How do you engage that? And then how do you get rid of the debris? Those dead cells have been there plaguing you, well, zombie cells, senescent cells, some are biohackers. And then what supplementation do you give the body for proper building blocks to build up? Our techniques are really based on that. And when you become, and I know some of the best chiropractors I've ever seen, sometimes it's not a time element. It's not a time procedure we're doing. It's really based on our expertise. And that's why when someone's really good at something, you'll find that they're very efficient. I will show you how to be very efficient with the Shockwaves to give exactly what the body needs when it needs it and watch the miracle happen. And that's as simple as that. And that's when I treated you, Fab. It was my pleasure to do that. But that's really, I gave your body exactly what it needed when it needed it. And then what happens? That's exactly what you needed that day to change your outcome. That's what it was.
What's your typical time frame whenever you have a patient? And I know patients vary from case to case, but what's a typical scenario when you are evaluating a patient and now you say, okay, I'm going to do Shockwave as part of my main treatment? What can a patient kind of expect as a length of time? And is this something that also requires later on maintenance, etc.?
Yeah. And it's just like with chiropractic. We detect and correct it to the best of the body's ability to heal. And then we maintain that with shockwave maintenance. And so we've done exactly the same philosophy with chiropractic: detection and correction, correct that body to the best of its ability to heal, and then maintain that same level of improvement for hopefully their lifetime. Because we only get one of these spines, we only get one shoulder, one knee, hopefully only one knee. But if we do that, we're going to be able to achieve the most mileage we can. I say mileage with all due respect. We're not driving a car here. But again, if you don't have to wear a joint out prematurely, why do it? But it complements what we do all the time, because most clinical packages and again, we could go through different diagnoses, whether it's 3 treatments, 4 treatments, 24 treatments. But if you look at all the different diagnoses that we do, and we have all these in a manual, I've diagnosed every single thing that I typically have saw over 28 years being in a chiropractic office into a musculoskeletal manual that allows you to take that diagnosis and have a framework of really what that looks like. And most of the treatment protocols are based on once a week for the majority of care for about 6 to 8 weeks. There's some accelerators we need. We need to base things on some science of cells. We want to maximize those cells at the beginning. So there's an increase in frequency at the beginning, very similar to increase that frequency of chiropractic at the beginning, right? But with the goal of maintaining that person's lifestyle. So if they're a golfer, if they're going up and down the stairs in their house, what's going to keep them going up and down their stairs? That's called maintenance. And it maintains that level of improvement for as long as you possibly can. So very commonly, a shockwave session once a month to really get rid of the damaged cells, bring in more blood flow, support those new cells we just grew, and also just supporting that central nervous system by a tune-up, if you will, once a month can be exactly what that human needs.
You know, going back to the first time that you took care of me, and I know both of us were busy during that time, I asked you if you would, because I saw the line of people that were being taken care of by you, and their expressions. I mean, that to me is what their expressions were like, you know, what just happened, you know, and I had the same expression later on. But one of the things that I love is the fact that when I got on the table, the first thing you do is you evaluated me chiropractically and you adjusted me chiropractically before doing shockwave. Tell me a little bit about why, in your opinion, this is such a great complement to the chiropractic adjustment, because I saw you do it, and you did it not only with me, but with almost every patient that you had. How is it that you complement that, and why is it that you feel that that combination is allowing you to get results when other people around you, they're failing miserably with these patients?
Yeah, and that's a great question, you know, and basically the question is, does it complement well with chiropractic? Absolutely. But also, too, I just want to let you know that because this is such a good regenerative technique with physical therapy and other non-adjusting modalities, it also has worked. So again, that's more based on the diagnosis. So if you don't adjust, there's a whole list of diagnoses that really, if you didn't adjust them, you would be able to resolve their issue. But when it comes to being a chiropractor and having one more tool in my toolbox called chiropractic, why would you not go to your bread and butter? So for me, I look at the nervous system to say, how do we engage the immune system? How do we engage it regulates how healing transforms? How do we do that? What's the master system? It's a nervous system. So especially with upper cervical, I have a lot of upper cervical doctors I coach. I love it I tell them there's more bones than just one, but they don't agree with me. But nevertheless, when you remove that nerve interference and just allow the brain just to communicate above, down, inside out, now we can start engaging all the systems of the body. And that's really, when you do that, what a miracle you can do. And so I believe, remember we talked about this earlier in this conversation, remove interference. Well, what's the biggest interference? Remove the central nervous interference. So the parasympathetic and sympathetic can talk to each other. We engage that central nervous system so it can start communicating the body. And then we tell the body, come here to this knee and start healing with all the lines of communication wide open.
Yeah.
What a beautiful way to just turn on what we've been given. What a God-given gift of healing. And that's what we do. So that's why if you got the tools, always they complement perfectly. And when you're advertising for a shockwave complaint out in the community, you will turn people on to chiropractic that would never even entertain the idea of having someone touch their spine, but it gives you the platform to tell the story, the chiropractic story, the healing, that the body heals from inside out.
And that's what I love about you. I mean, you trained so many doctors like me on this technology. Tell me, for somebody out there that is thinking about, you know what, that sounds like a technology that I want to have in my practice, what are the first 90 days look like? Because one of the things that I have seen from some of my friends, especially that recently bought the machine, is your level of training. I mean, you get very hands-on. Your protocols are amazing. I mean, you got a manual that is that thick that actually takes you to everything you could possibly experience in that practice. But in your own words, tell me what a typical 90-day experience they can expect once they introduce this technology in their practice.
Yeah, and I can tell you what we've done so far, because it's a recipe, right? It's a recipe for success if you're coachable. And what I mean by that is, like, if you can take that information and apply it, you will change your base of your office. So what we do is typically, what we've done is we've ordered a machine, a Hydrowave machine. Then that automatically triggers my engagement of level of training. So even before you get the boxed item and you open it like Christmas, right? Oh, I got something. Now, you know, how many of us have done that? You open something and go, now I got to read a manual how to use it. Mm-hmm. We order the machine. And then after that, then I start your training. We have a learning management platform that goes through everything that Dr. Fab and I just talked about. A through Z, how to launch in your office, how to become proficient with the technique, how to give a report of findings and a nice, concise slide deck that is reproducible for consistency and outcome. Because at the end of the day, we haven't talked about this, your doctors, you want to make money, right? So we might as well have a system that allows you to make money that typically pays for the machine many times over in the first 90 days, but that's to the side. So once we've trained you, given a report, given you a Hydrowave care class, teaching the cellular level how to heal, internal campaigns, we've gone through everything with you and your staff, getting your front desk to have scripts on what to even say about this machine. Then we train hard in 30 days at your own pace, learning management system that's online 24/7. We have a Slack channel to answer any of your questions. That's a special software that does it. And then we do a once a week hour training. It's an open forum, group coaching, allows you to answer questions and really have a community of other providers allowing you to communicate to one another. So that way, the time that you open the machine, the box opens, Christmas Day, you look inside, I got my new machine, I got my new Hydrowave. Now what do? You'll know what to do. So the day you get it, you can put it to use. And that's how I think we stand out with systems and efficiency. And that's kind of what to expect on when you get a Hydrowave, the level of implementation that is unique to us.
Well, and the reason I ask you that question is because we notice that many times people get excited. They go to a seminar, they listen to a lecture, they may be even listening to this, but then all of a sudden they get the machine or whatever the technology may be, and they don't know how to really maximize the potential, how to really make sure that every one of their patients has an application that they can benefit from. But another thing that surprised me is the portability of the machine, where not only can you have it in an office and move it from room to room, but also where you can take it on the road with you, especially if you are not a sports doctor or somebody that does visits, or you may be somebody that works with companies where maybe you go into a company once a week or etc. Tell me a little bit about the portability of it and how has that been an asset for you to be able to bring this technology to people that can't come to you?
Yeah, and we've done VIP visits, and we've been able to put this machine into a suitcase, so to speak, and wheel it into any home. I've done locker rooms. I've done screening events. There's so many applications because it is portable. And that's one of the things that we've also been able to create solutions for, is making it portable and making things, we don't need a generator to make it work. And that's one of the special things that we've been able to do as well. But those types of portability open up the door for just endless applications. And really what it comes down to is, as a provider, we all have dreams. We all have ambitions to, create our own, and that's your Picasso. That's your masterpiece. And so when you have a machine or a technique or a combination of both, which what you provide, you can apply it to your masterpiece. And whether that's going to corporate buildings, going to the community, educating our community to bring more new patients into the office, going to locker rooms to support a high school team or college team or NFL team, or even a baseball team, whatever you choose, that is really what this utility can do for you by being portable, being small, and also some of the things we've created solutions to do that. So it makes it unique, but it's also to really look at what your dream is and to fulfill that dream.
Well, and especially after going through the pandemic, I just think that anything that we have that's portable is an asset, because we don't have to be bounded by the location that we currently have our practices. We can actually help people wherever they may be. So in closing, what would you say to yourself is maybe the one thing that you would love everyone that's watching this or hearing this to understand about the value of Hydrowave? What is the one thing that you feel like hopefully they can take away with them, and in your opinion, that every single day you're reminded, thank God that we have a technology like this right now for so many of these type of patients that is helping right now?
That's a again, fantastic question, because I think in closing with this machine, I can certainly stand in front of you, not saying that I've probably been the smartest man, but I've also learned from my mistakes and been a great learner of my mistakes, and to turn something that maybe turned out not so good into something fantastic. And so I'd inspire instill in all of you, if this can happen for me, it can happen for you. You can be super successful. And I think what I probably would share with you is I've made lots of mistakes by not knowing the technology. And my assistant said, your patients deserve your expertise, not your experimentation. And so I think for me, I've taken out the guesswork for you by making a lot of mistakes and probably hurting more patients than I should have. I always think of the one quote from Clarence Gonstead. He said, any regrets? And he said, I would have wished I would have took back a few adjustments, because he over-adjusts. He had to pioneer what he did, and so he didn't know whether the body needed more or less. He just kind of guessed at it. And that was his honest truth, and I love his honesty. And I think for myself, it's the same honesty that says, I made a lot of mistakes, and I hope that I can share with you those mistakes so you don't have to make them. Take the guesswork out, implement a tool, and really just promote your clinic into just really the center where people go to get solutions and health and wellness and hopefully lifetime care with your organization.
Well, thank you so much. It's always such a joy to spend any time with you. You're such a good educator. But more importantly, I've always told you that one of the things that I've been the most impressed with you by far is your authenticity. I mean, you are who you are, no matter where I've seen you. And I know we've seen each other in multiple places over the last few months. But for those of you that are listening, I'm going to put a link here where you can connect with Dr. Martin and be able to answer any other questions that you may have, because the important thing for me is for you to be an informed person. Whether you're a provider right now and you're saying to yourself, yes, I have some tools, some technologies in my office, but I don't have a Hydrowave. It will be something that I'm interested in learning more, see how it fits your practice, see how it fits your patient base, but also think of it also as a new vertical, a new patient base that potentially you don't have right now. Because all I can tell you is it works, and it works fast. And that's one thing that anytime that I find technology like that, I'm all over it, because I know that the patients will sign up for the plans that you provide, whether it's a 12-visit plan or a 24 or a 36. They'll get it because they already saw in a short amount of time benefits. And that's what they're looking for. Number two is, if you're a consumer like me, and you're looking for technology that you may want to add to your regimen, also make sure that you contact Dr. Martin, because he'll be able to answer any of your questions. And one of the things that I can tell you is you will be trained well. You already saw in a short period of time how well of an educator he is. Trust me, you get spoiled, because when you have him on a weekly basis and you have all this information that he's put together, he's made it very practical to implement. And that's one of the things that I love about the Hydrowave process. Is not just a technology, it's a system, a turnkey system that would allow you to help many of your patients as you move forward, or that would allow you to help you and your family members if it's somebody that you're looking at this technology for yourself. Like if you go to my house upstairs, I have probably more technology than most people. And that's because I've always been that kind of person. I always want to have the best out there to be able to maintain my health to the best ability. So make sure that you click on the link, get more information, and know that this is something that I really am excited about. Because with all the health problems that we're sitting with today, and all the lack of hope that I'm seeing in patients that are being told there's nothing we can do, this procedure failed, this medication does not even touch what I'm going through every day, now we have something like Hydrowave that can actually help you and your patients more than ever. So God bless you. Thank you so much for joining us. And I look forward to continuing to go on this journey with you. And I appreciate so much that you're taking the time to be here with us, to be able to learn a little bit more about the things that will help you become healthier, and more importantly, help you help those people that you serve, because that at the end of the day, there's no greater joy than that. See you soon.
To learn more about Dr. Fabrizio Mancini's groundbreaking work, visit www.endingchronicdisease.com and join the movement. Together, we can end the silent epidemic of chronic disease and create a healthier, more vibrant world. Thank you for tuning in. Until next time, be well and stay inspired.